The question being which Medicare supplemental policies offer the best value for most seniors and why is a fairly vague question in that Medigap policies have the letters, as you're probably aware. They have F, G, L, M, and some other numbers or letters, sorry. I give them names to keep them straight. And because I work in a variety of different states, I can advise all of you that depending on what state you're in, the price of that policy is going to vary widely. So I could say that the G policy is the best way to go in county, whatever county. But then we look at, the pricing on that policy in a different county, for example, Washington State or Minnesota, and that could be cost prohibitive. So that's not necessary. The cost isn't standardized across the nation. So that's a very interesting one. So we need to be mindful of that. So there's no one rule there. The second no one rule is that most communities have a different configuration of private versus public hospitals versus, charitable hospitals. So what's true in one community is not necessarily true in another community. And what I mean by that is the overage charges, which bring the reimbursement up to usual and customary for certain facilities that are private facilities or certain doctors that don't accept Medicare as full and complete payment. So if that's the case, then obviously the G policy is really the only option for my clients. However, that may be too cost prohibitive if an individual is in an expensive area. So this requires, again, health insurance, Medicare is no one best way, and we need to stop treating it like that. We must do a thorough analysis of the individual's needs, the capacity of the community to meet that needs, and also their social resources, meaning money and time and treasure. So let's have a broader dialogue about this rather than either or, the one best way. Find excellent assistance. Don't rely on one person. Don't rely on any one government agent. Find an excellent advisor in your community that can assist you. And we do it for free when we're brokers. So keep digging.